We're live here at HCIC in Austin, Texas.
Podcasters are today's influencers, so you included.
I'm no influencer. Being a little bit modest. He's modest, guys. You're not deliberately being a competitor. You're just better at it. We're here live at HCIC in downtown Austin, Texas. We're actually not really we're in the JDW Marriott.
I mean, it's pretty close to downtown.
Pretty close to downtown. Yeah. Very adjacent to barbecue. That's the most important thing.
There are lots of meats here.
Exactly.
Meats.
And we're here with good friend Matt. Matt, it's been like so long since we've actually recorded a show together.
True.
And here we are. I'm excited.
Yes.
All right.
Get it.
Well, share a little bit about you with our audience first.
Sure. So I'm Matt Gove. I am currently the Chief Marketing Officer for QuickMD, which is a direct-to-consumer telehealth company, fully remote, but based in Los Angeles, California. Prior to that, I was the Chief Marketing Officer for Summit CityMD, which was a New York-based private equity-backed roll-up of multiple healthcare companies that we sold to VillageMD. And then even earlier, I was the Chief Marketing Officer and Chief Consumer Officer for Piedmont Healthcare, which is around the time we met.
Yes.
Back in the day. So I've been around and seen a few things.
Well, and you made that jump from a traditional healthcare system to really the direct-to-consumer care that's out there, which is a model of care that is just lighting up. It's good. It's on fire now.
Yeah.
And I mean, this is what I want to talk to you about, because quite honestly, I see it all the time. I know it's disruptive.
Yeah,
but you know how it's disruptive. Share a little bit about your perspective on this.
It's interesting. So I was in New York during the pandemic and saw how critical urgent care was to the care of that metropolitan area during a really difficult time. But we also saw customers on the multi-specialty side of our business of Summit Health, customers who preferred, obviously, to be seen by a physician via video or even on the telephone versus coming into an office when things were so uncertain. And so it exposed a group of patients that had never really considered telemedicine before. It exposed them to a medium and gave them comfort. Once people started to get comfortable with this idea of seeing physicians that they knew and trusted, to talk about an issue that was specific to what the physicians specialized in, they really did start to pick it up. And there was a point during 2021 when almost we had moved our daily volume at Summit Health back up to, I don't want to say exact numbers, but back up to about 90% of what it was.
Oh, wow.
And fully 90% of that 90% were video visits.
Wow.
Like our docs were in their houses, in their homes or in their offices, seeing these patients, and the patients were receiving satisfactory care. And so that's, it's been really interesting now in my new world to see the further evolution of patients who know what they want, they trust us to deliver it, and they would rather see us than visit the physician down the street. So it's not just for those patients who are in locales where they need access, they don't have access to it.
Like remote locations or whatever.
For sure.
Very urban areas where your doctor may be right down the street, but I'd rather open up my phone or my computer.
And I think there's a lesson to be learned for health systems in this, which is patients are going to continue to get more comfortable with this modality.
Right.
And they're going to continue to figure out ways of accessing it.
I think telemedicine has been a godsend to the behavioral health industry. First of all, we have a shortage of behavioral health professionals. Secondly, that the medium allows you for very quick access, and particularly like if you have a relationship with your therapist and you had maybe a bad moment, you want to just have a very quick touch base, whatever it might be, or even for that regular check-ins. That's where I see a really interesting use case. And almost like this is going to elevate telemedicine's adoption even further, at least in that space. What are your thoughts?
For sure. I mean, there's no doubt that when you marry the medical treatment with the therapy and your services, it will help adoption of it. But I think it's to me, it's an example of what telemedicine could do and the doc shortage that we all know is coming.
Yeah.
As boomers age into needing more and more regular care, and we don't make as many doctors as we used to as a nation.
Yeah.
And so the availability continues to get sucked up in a health system. And so how are you going to treat people with everyday issues, or how can you find those specialties in your organization that are perfect for this type of modality, this type of channel, and push more of your patients into it so that you can see more of the in-person care that's required at your facilities. I think it's an obvious way to extend the ability of your providers to see more patients,
Yeah.
and extend your ability as a health system to take care of more people in your community with relatively little investment. One of the things I'm enjoying the most about QuickMD, and one of the biggest opportunities I see for us, and the conversations we're having inside our organization now are, there's no reason we can't be them.
Yeah.
There's not a huge capital infrastructure like a health system
Right.
that is required to build it. So I say that in part for our own aspirations. Like we can be whatever we want to be. It just honestly just takes more docs and more computers. But that also shows health systems how easy it could be for someone to come in
Right.
and carve off a piece of their business and take it for themselves.
Right. So you're not, even though you're in this space,
Yeah.
you're really saying that you're not deliberately being a competitor. You're just better at it right now. And health systems have an opportunity to catch up.
Like, it's a huge opportunity for systems, and no, we are better at it only because we've been doing it.
Right.
But no, also we're built to see and serve a need.
Right.
And I think there's still occasionally some systems there's still sort of we built it and they will come attitude.
Yeah.
And going out into the community and identifying these opportunities makes more sense to me.
Well, I think, hearing your career trajectory, moving closer and closer to the consumer and understanding like sort of the mediums that are getting closer and closer where the consumer needs are, it makes a lot of sense, Matt. And, this is why people, you need to follow this guy because he's speaking the truth and he's like living the future. Matt, thanks so much for all your time today.
Of course.
Sharing some of your insights. It's always great to catch up.
Yeah, great.